Greetings. My name is Caldwell Esselstyn, Jr., and I direct the Cardiovascular Disease Prevention and Reversal Program at the Cleveland Clinic Wellness Institute. It's my privilege today to share with you some of our strategies and research for the treatment of coronary artery disease. I think that probably the best way to get started is to share with you the results of an editorial that I wrote for the American Journal of Cardiology approximately 4 years ago. And the title of that was, "Is the Therapy of Coronary Artery Disease the Radical Mastectomy of the 21st Century?" Now, what in the world did I mean by that? For 100 years, the radical mastectomy was sort of the standardized surgical error. And this was started back in 1882 by William Halsted. And Halsted was a towering figure in surgery. And all of his residents went on to become heads of surgical departments throughout the country. And the radical mastectomy was perpetuated well up into the 1970s when courageous physicians began to challenge this radical operation. Here we see the operation of radical mastectomy, where the entire breast is removed, all the muscles beneath the breast, a radical lymph node dissection, and this had to be originally closed with a skin graft. Now, this was such a mutilating, disfiguring, and challenging and painful procedure that many women chose to rather simply look at the lump in their breast and watch it rather than have this operation. But in the 1970s, courageous physicians really began to challenge this procedure, and lo and behold, it was found that lesser procedures would bring equivalent results. And my question was, are we actually getting into that same rut in cardiology today? For the last 40 years, we've used fairly similar drugs, the same procedures of stents and bypass, and yet coronary disease remains the #1 killer of women and men in Western civilization. The question is, can we do better? And I think we learned some very valuable lessons when we looked at other cultures. For instance, if you were to be a cardiac surgeon and hang out your shingle in either rural China, the Papua Highlands, possibly rural the Central Africa or the Tarahumara Indians in northern Mexico, forget it. You better plan on selling pencils. Why? Because these cultures, by heritage and tradition, thrive on plant-based nutrition. Cardiovascular disease is virtually non-existent. Now, this particular slide reminds me to share with the audience that if we were to autopsy our GIs in Korea, we find that of those 20-year-old GIs, roughly 80% will have gross evidence of coronary artery disease that you can see without a microscope. Not enough for their cardiac events yet, but there it is, already established at age 20. And nowadays, when we autopsy young women and young men between the ages of 17 and 34, we find that the disease now is ubiquitous. You graduate from high school in this country, you get not only a diploma, but you also get the foundation for heart disease. And it's not a great surprise that if we continue to eat that same way through the rest of our 20s, 30s, and 40s, now we begin to see those clinical cardiac events with a disease that had its inception really almost in childhood. Now, what about what we do to the rest of the third world? When we ship our Western diet to places like Naro, the incidence of diabetes is now up to 40% of those residents. When we ship our diet to Trinidad and Tobago, heart disease is up 25%, and to Tanzania, hypertension is up 30%. In other words, really we should be having it just the reverse, but we're shipping our diet overseas. We're not having the advantages of some of these basic diets that have existed for years in cultures where the disease is non-existent. Now, some would say, for instance, that if you are physically active, that you can perhaps keep this disease at bay. Well, there was a study done in Germany looking at male marathon runners. To qualify for the study, you had to have run 2 to 3 marathons a year. All these participants were over the age of 55. And when they carefully studied them, 90 of these 100 had cardiovascular disease. So indeed, exercise cannot absolutely hold this disease at bay. Now, 4 years ago, when I was a moderator of a panel in Los Angeles, one of the panel members was Lou Culler, who was a professor of public health at the University of Pittsburgh. And on that panel 4 years ago, as a result of his 10-year cardiovascular health study, Lou Culler made the following statement. All males who are 65 and all females who are 70 who have been exposed to the traditional Western diet have cardiovascular disease and should be treated as such. Now that is pretty powerful stuff. Now, here was an opportunity that we had as a profession to absolutely get it right. World War II. In World War II, it was characteristic when the Axis powers of Germany overran the Low Countries of Holland and Belgium, and when they occupied Denmark and Norway, they took away their livestock for their troops. Their cattle, their sheep, their goats, their pigs, their chickens, their turkeys, gone. Now suddenly, these Western European countries were now plant-based. And it was fascinating to look at an article by Drs. Strom and Jansen, reported in England's leading medical journal, The Lancet, in 1951. They looked at the death rates from heart disease and stroke in Norway in and around this period. Now, to make some sense out of this next slide, let's begin at the left, and we can see in 1927, the heart disease and stroke deaths increasing up to 1930, increasing to 35. 1939, in come the Germans. Whoop! 1940, 41, 42, 3, 4. Who knew these Germans were these great public health educators? But look what happened. As soon as we had the death of Adolf Hitler in 1945, with the cessation of hostilities in the European theater, back comes the meat, back comes the dairy, back come the strokes, back come the heart attacks. Look how promptly that occurred. Emile Picard, who was a pathologist in Belgium, was telling his students at the autopsy table in 1946 and 47, he said, look at these plaques in these arteries. We didn't see these during the war years. Now they're back. Pretty powerful statement, but as I said, we just didn't get it. Now, there's another interesting study that sheds a little light on this. This is a study of 905,000 person years of follow-up in a group of individuals, and it was quite striking to look at men and women at age 55 who had absolutely optimal risk factors. And yet, if you carefully follow those persons for the next 30 years, 40% of the men, 30% of the women will develop cardiovascular disease. In other words, the Western diet may get you early, and it may get you late. Now we get a little more serious. Here we're now looking at, obviously on your right, there is an artery that is thoroughly diseased. And you'll notice that the small opening in the center is where blood is still flowing, and you're probably saying to yourselves, when that closes, there'll be a heart attack. Well, interestingly enough, only about 10% of heart attacks occur from lesions that look this nasty. Yes, somebody will have perhaps angina with this, they may have shortness of breath, but we'll get in a moment to how 90% of those heart attacks occur. On the left, what I want you to notice is even those who might be in the back of the room, looking at that normal artery, that the innermost layer is that little dark line, one cell layer thick, and that magic carpet has a name. It is the endothelium. And the endothelium truly is the life jacket and guardian of our blood vessels. And all experts would agree that when we injure the endothelium, that's when we have the inception of this disease. Now, we're going to shift gears for a moment because I want you to see this angiogram, and on the left in the upper corner, you'll see clearly an angiogram of the coronary artery, where the blood vessel is outlined by this contrast. Now, the other wrinkle that I want to share with you at this time is this ultrasound, because although we learn a lot about the inside of the artery from an angiogram, we really learn a lot more when we can add an ultrasound. For example, if you look at the photograph in the upper left quadrant, you'll see a yellow and blue arrow. We are now going to advance a catheter with an ultrasound probe to where the yellow arrow is, and then we're going to shoot a film right at that yellow arrow, and there it is in the lower right, D. And you can see clearly the tip of the ultrasound catheter within the lumen of the artery, and the lumen of the artery is very smooth, clear, and straightforward. We then simply advance that ultrasound catheter another few millimeters to the blue arrow, and we shoot another picture, and that's in the upper right, B. There again you can see the tip of the ultrasound catheter and the outline of the lumen of the artery. But now you see, in addition, this crescent-shaped configuration, and that is a plaque. Fascinating that when the artery first starts to become diseased, it does what it can to maintain the caliber of the lumen of the artery. And yet that plaque, yes, is it serious? Sure it is. Even though it's not blocking the artery, yes, because what happens when that plaque ruptures can be a potential for disaster, as we'll see. Now, the first thing that happens when you start eating the cheeseburger, the milkshake, the pizza, if we look at on the left of these three drawings, there is a plaque, and inside the plaque, things begin to get sticky, as they do throughout the cellular elements that are flowing. Once you start eating that Western food, we increase this stickiness. And now we're going to make a little shift of gears, and I'm going to come back to this in a moment. But here is a configuration of a drawing made by actually Dr. Peter Libby from Harvard. And where the blood is flowing is up there in the blue area, and the blue area is separated from the rest of the arterial wall by, again, those purple single-layer cells we call the endothelial cells. Now, to make sense of this, if we go together to the upper left inside the blood, we will see those orange molecules, which are the LDL cholesterol. But they're now sticky because you've eaten that pizza, as is the endothelium. So we now have migration of those LDL cholesterol molecules into the subendothelial space, whereupon they now become oxidized. Oxidized by the free radicals that exist largely from our food that we've eaten. Now, the subendothelial cell space does not like these small, hard, dense, oxidized LDL cholesterol particles, and so it sends for the SWAT team. And the SWAT team are our white cells, which you see here painted blue by Peter Libby of Harvard in honor of Yale, and we like that. Now, once that white cell has crossed into the subendothelial space, it begins to gobble up these nasty yellow, oxidized, small, hard, dense LDL particles. And as you can see, if we follow the arrows across to the right, finally on the right, we do in medicine what we do so often to confuse people, we change the name. The white cell, or the macrophage, is now referred to as a foam cell, absolutely filled with all these LDL oxidized cholesterol particles, and this is a cauldron of oxidative inflammation. Now, this is, interestingly enough, some fascinating work from George Abella, who is from the University of Michigan State, where he became quite fascinated, wondering what would happen when this plaque ruptured. And we're going to come back to this in a moment, because I want to take you back to this diagram that you were familiar with, because the foam cell that we just talked about elaborates these nasty, nasty enzymes, metalloproteinases, such as stromelicin, elastase, collagenase, myeloperoxidase. What do they do that's so bad? They actually erode. They erode progressively this cap over the plaque. And if you look carefully on the left, as you go to the top of the cap over the plaque, you will see it's gotten very thin. And there, the sheer force of blood tearing over that thinned out cap can tear it. Now we have that seminal moment where the plaque has ruptured. Once you have ruptured the plaque, you now have the extravasation, or the oozing out of, if you will, of plaque content into the flowing blood, which activates platelets, our clotting factor, and now suddenly we go from A to B, the middle diagram. There it is, a clot is forming. And in another minutes or so, since the clot is in and of itself self-propagating, we now go all the way over to C. And now we have what? We have an artery that is totally blocked. Previously it was blocked 35%, not enough to cause anybody any symptoms. Suddenly with that rupture, in a matter of minutes, the entire artery is blocked. All the downstream heart muscle now is deprived of oxygen and nutrients. It starts to die, and that's the heart attack. But if I do my job correctly today for you, this entire cascade of events can be obliterated. We can absolutely vanquish this. And how do we do that? With a drug? No. With a procedure? No. With an operation? No. No, I have to get you to change your internal biochemistry. And you're going to do this safely, thoroughly, and effectively with food. And what's going to happen is this entire cascade of events that I've just described, of things getting sticky, migration of LDL cholesterol into the subendothelial space, creation of the foam cell, thinning out of the plaque cap, that ceases. You will actually strengthen the cap over your plaque. When you strengthen the cap over your plaque and thicken it, it cannot rupture. And when you cannot rupture your plaque, you will have made yourself heart attack proof. Now let's go back for a moment to this drawing by George Abella. This is not actually a drawing. It's a electron microscopy, a picture of the arterial wall at a particularly very poignant moment. George Abella was fascinated with what actually occurred when that plaque ruptured. So he was able to secure the autopsy of 19 people in and around that Lansing, Michigan area in Michigan State. And he carefully studied the area of the heart blood vessel where the plaque had ruptured. Now to do this, he did something a little bit unique. Traditionally, when physicians look at tissues under the microscope, they will first dehydrate them with alcohol, something that's been done since 1743 by Baker in the United Kingdom. George Abella chose not to use alcohol for fear that this might introduce an artifact into his understanding of this methodology. So he used what we call vacuum dehydration. And with vacuum dehydration, he was able to look carefully at the area where the plaque had ruptured. And here is what he saw. That spike that you see is a cholesterol crystal. Now the body is really quite fascinating. For as long as possible, as you're increasing your cholesterol, it'll try to keep the cholesterol in solution. But once you have overwhelmed the capacity of the body to keep the cholesterol in solution, it then begins to crystallize. Now you're probably saying, well, wait a minute. I think, Dr. Esselstyn, didn't you just tell us that the plaque ruptured when it got so thin, and now you're showing us this spike of a cholesterol crystal? No, because what George Abella did was fascinating. Yes, he found this at the area where the plaque had ruptured, but he also found within the arterial wall, in areas where the plaque had not ruptured, these same crystals, but they were not able to rupture the plaque cap if it was 200 micrometers thick or greater. But if it was 100 micrometers thick or less, yes, it could rupture. So it comes back to the fact that we want people to behave themselves with their nutrition so they can live in a way that if they do have this burden of plaque, they will thicken the cap over the plaque and prevent it from rupture. And this is simply an example of the difference between using dehydration on the left with alcohol. You can see the configuration there is really quite irregular and could lead to artifact. On the right, with vacuum dehydration, you can see definitively how these cholesterol crystals will form. Now, this is to give you a bit of a break. I've had this in my presentation for years. This is Dwayne. Halfway through his hearty man breakfast, Dwayne felt he heard several of his small arteries slamming shut. Well, what I'm in the process of sharing with you today is going to be 4 natural defense mechanisms that have to do with protecting you from having coronary artery heart disease and from having that nasty problem of a plaque rupture. And the first of those is going to be the endothelial cell. And we were going to come to that in part 2. Thank you.